The other thing that I think we can quickly touch on is I think one of the most distressing things we find is hair loss in women. I think that is uh, understandably very, very distressing. And could you do like a 2-minute session on hair loss in women? And
Yeah, so when you see a woman with hair loss, the majority of the time, it's common things being common, it's most likely going to be what we call androgenetic alopecia. Androgenetic means that it's genetically motivated and due to the effect of androgens or hormones in our blood that affect the growth of the hair. So as women get older, the hair loss, as their estrogen goes down and the effect of testosterone goes up in kind of that seesaw fashion, it causes hair loss like we see in men earlier, because we have more testosterone, less estrogen. So we have that problem earlier on in life. So it can be really damaging psychologically. Obviously, the quality of life issues. The first thing that as a dermatologist you want to rule out is this something other than androgenetic hair loss? Could this be an inflammatory hair loss? And the inflammatory hair losses can be scarring or non-scarring. And so if you have a hair loss that scars, you need to treat it as quickly as possible. You need to stop that inflammatory process. You need to put them on. There's many different forms of medication that can be used for those, but those conditions are probably irreversible. So every day that you wait on treating that hair loss could be more permanent problems down the line. But things like androgenetic alopecia, the hormonally driven hair loss, we have a lot of treatments for it these days. Like Vineet said before, we have topicals like topical Minoxidil. The common name in the US is Rogaine for that. We have oral medications, and now, I'm part of one of these studies. They're going to be releasing in the next few years a sustained release minoxidil pill. The problem with minoxidil that we have right now as a pill, it's that immediate release, and you get kind of this peak over an hour, and then 23 hours with no effect. So this is kind of releasing that drug over 16 to 20 hours, and should promote dramatically better results. So the most important thing when you're addressing hair loss is the earlier you start to treat it, the better the results are going to be. Because once that hair gets smaller and smaller and smaller, and that's why it looks like your hairs are disappearing, it's actually shrinking inside your skin. The earlier you treat it, the more of those cells, the more of those hair follicles that you can recover. And so waiting is never the right option. When someone just starts to see hair in the shower, that is the time that they need to start treating it, because you can completely prevent the progression of that hair loss. Versus if they have a bald scalp, there's no coming back from that. At least we don't know how to do that to this day and time.
so it's way, way too late for somebody like me then.
Well, hopefully we come up with, and we don't know, we may come up with an advancement 5 years from now that completely revolutionizes how we understand hair loss treatment. There is a thought that those miniaturized hairs may be reversible. We just don't know how to do it. But that doesn't mean it can't be done. It just means our technology hasn't reached that stage yet.
Excellent. Hey guys, thank you so much. I think it's been just an amazingly educational and instructive session. Thank you very much. And for the audience, I once again like to remind you that all the information was general and is meant to just give you a little flavor of what all is available in the region of dermatology. Please talk to your doctors, and if you want to, it's very easy, make an appointment with Dr. Friedmann or Dr. Mishra through myamericandoctor.com. And good luck to you all. Thank you very much for listening.
All right, thanks for having us.
Thank you. Bye-bye.
Thank you.
All right. Bye bye.
Bye-bye.